of tetralogy fluid repair.
Well,
Okay.
what's that in English? Test?
His heart disease. His heart disease that was repaired when he was a baby. From the scar on his chest.
Keep in mind, all this started immediately after the
Well,
after
that
the
don't matter
injections.
right now.
Yeah, it does.
Well,
Yeah,
Yeah, it
that's the
does.
main that after he got them,
Absolutely.
he wasn't only just sick and had a fever and coughing and runny nose. It was a complete change.
'Cause
It
it
was
was like
accident
a-
to eliminate his
Like
prior
he had his
conditions,
hemoglobin, all of that blood stuff and everything,
Just let
like
me finish.
when he got before his shots,
When you checked
and
those
it was
things.
all normal
Okay.
to above average. You know what I mean?
Okay.
Like it was all good.
Before he got the shots.
they didn't wanna
I
see him
understand.
for a year, is what the cardiologist said.
Yeah, the cardiologist cleared.
And then now the neurologist is ruling out from yesterday's
It's clots and hemorrhages.
test, you know, that the
I
heart's
understand.
functioning
Clots and
perfectly
phlegm.
normal, blood oxygen levels right, there's no ruptures, there's no blockage, there's no lack of anything, everything's functioning properly.
So what would temporarily
So-
cause that
Can I
artery
give
to
a
close?
can I give a scenario here, and please let me go through all the way through this. Tell me if you think this is any chance at all or not. That he got the injections, that his immune system was overrun, having to fight the injections, having to fight the injections, and then from that point, that some of the normal flora possibly started to take over. That how do I want to put this? That some sort of inside infection occurred because his immune system was overrun, because his temperature was fluctuating. They said between 96 and 102. So what I'm thinking is, tell me if you think that this is a possibility. He got the infections, his immune system was ramped up, some sort of inner flora or something within his bowel, since his stool was showing positive for some things, his stool changed color, that he was overtaken by an infection because his immune system couldn't keep up with adjusting to the injections and with some of the normal flora, that because of that his temperature increased to fight it off, that because of that he developed a systemic infection, an acute case of encephalitis or some sort of intracranial pressure. Because of that, they compressed the blood vessel that led to the stroke. Is that possible?
Because his spinal fluid pressure was above.
Let her
Because
answer.
this is
Let
what
her
I
answer.
think.
I don't think I'm qualified to answer that question, honestly.
It would be then.
What I can tell you is that
We need a
I've not seen
neurologist
that
together.
described everywhere. I've not seen that described anywhere.
I used to work
Okay?
in surgical tech, and I went a little bit further as far as the studies, and I'm just trying to dig out what I know, what I've seen, and put the basics together, and knowing that being given an injection, it's going to ramp his immune system up, and that you've got normal flora, you've got things in the bowel that are supposed to be there, and then if the immune system in general, in nature, is supposed to keep those in check, as you know, and that the immune system could have been overrun by the injection to the point that it couldn't keep up with some of the normal goings on in the body as far as normal bacteria, that he developed an acute case of an overrun infection from those, which would raise the blood pressure, which could cause a systemic infection, which could cause, with his temperature going up, and especially in his brain, cause an acute case of intracranial pressure, which would be why everything is checking out okay right now. That just happened at one occurrence while this was going on, and that he developed intracranial pressure, put pressure on that one blood vessel that feeds both sides of the thalamus, cut off the blood flow for long enough that the stroke occurred. That's the best picture that I can paint in his
Here's
case
what we're
of
scared
what
of
possibly
here,
happened.
is we wanna make sure that this doesn't reoccur.
Mhm.
So we need to know what caused it. If we're doing something wrong, we need to
Understand.
know.
I understand you do. I understand you do.
Did you say his
And I hope we can
fluid
get that
check
answer
was,
for you.
did you say, you were starting to say some
What I can
fluid
tell
checked
you-
high on the temperature?
On the pressure.
His opening pressure, the doctor
We
said,
just need to
she still
understand
hasn't
I
been
know.
able to
what
explain
is
her
happening.
what she's trying to tell.
I wanted to come in here and give y'all results and kind of tell y'all what I know so far. What I can tell you is that we have not had any evidence of infection in his brain so far. His white blood cell count, which is normally what we would see with even a bacterial infection from the gut that got out of control or whatever, if it was a bacterial infection that got into his brain, I would expect to see increased white cells.
I wouldn't
Even
expect,
with
no,
an
I wasn't getting
antibiotic?
it, I wasn't getting it
Even with an antibiotic, absolutely. I've treated lots of kids with bacterial meningitis with
Even
brain
if-
abscesses.
Is it
I think-
possible, how long until you're gonna be
I understand what
completely
he's trying to say.
fulfilled with your tests? Until you can,
When my tests are done, I don't know exactly when all of them will come back. Most of them are sent out to reference laboratories. It usually takes me about a week to get all those results back. They will come back gradually as they're done.
okay,
The ones I have back so far are the malaria tests, which are negative.
Thank you.
Okay? The enterovirus test, which is negative. The culture from the CSF from the first spinal fluid, which is negative. The second spinal fluid culture, which is negative to date, which means that they're going to continue to hold it. Okay?
By the time this is all said and done, are we gonna have an answer of why exactly this happened? Because that's the whole reason why we're here. You
I
know
understand.
I'm gonna say
What I mean?
Well,
And if there's no other explanation, and there's nothing else going on in his body right now, or previous
Then
or
we'll be
past.
confident of what we're thinking is right, but, you know, that's why they're here and they're trying to explain. We need to understand what happened and why it happened.
I just
And
don't want to
Then
walk
let
out of here
explain
with
that.
everybody being like, oh, well, there's
You just
nothing
gotta
wrong
wait,
with him. It
you
just
know,
happened.
just wait till the time comes.
And
You
Well,
got-
It
well,
just
you certainly
happened.
don't want it to happen
what
again.
okay, hang on.
Troy, there's no sense even getting into that right now. I mean, wait till the time comes and then just.
What I can
When
tell
does
you
this
is
happen?
that as I get results, if I come up with an answer, I'm going to give it to you.
Absolutely.
Okay? If I get a positive result, I'm going to give it to you. The positive results I've gotten so far, I've given to you. Okay? They don't explain, in my mind, with my training, with my experience, they don't explain his strokes. The salmonella culture, the adenovirus antigen, neither of those explain these infarctions.
Does that make sense to you? The question he just asked? Like, is
I've
that a
never heard-
possibility?
I've never seen that described in literature. Okay? I've never seen that in experience.
I could show you on the computer.
It
But
can.
it could be possible.
She said she would read that and interpret it to
I'm
you.
more than happy to read whatever y'all want me to read. Okay?
That's
I'm more than happy to. I've been doing this quite a while. I've seen a lot of vaccinations.
So why don't we just have her read
I've
that
not seen
and see what she
strokes
has
with
to say about it?
vaccinations.
Just give her the website, you know, and then.
You can write down the
when she's
website.
got
I'm
it,
more
she's
than
got
happy to
enrollment.
look at it.
Or we could forward it to you if it'd be easier.
If you'll
If
just
you have
write
an
it down,
email.
you can. I won't get to my email probably in the middle of the day. But if you'll write it down for me, I'm more than happy to look at it. More than happy to.
When would it be possible we can meet with the neuro and also yourself? So we're not slinging questions back and forth, because he stood right here, he was wonderful, the man was
He's
wonderful,
he's
as
great.
you are too, thank
He's
you.
great.
So that way, I think, because the infectious disease and also the neurologist, the two main parts to this investigation, we'll call it, are together, and that way, we just as a family need to understand why, and we wanna make sure that we don't get Logie home, start rehabilitation and everything, and then it reoccurs.
Right.
Cause we're running out of time, and this is out of your field, but the neurologist confirmed with my conversation yesterday with him that, you know, we have some time for his brain to still continue to develop.
Sure.
And we have a better chance of repair, you know, up to
Yeah.
100%. So, in other words, when we leave here, the clock is ticking on the time that we have to repair, rehab, and develop, which could be, again, up to 100%, which is our goal.
Right. Absolutely.
So, if we could get you guys together and then ultimately get our questions answered and then, you know, have an idea of what to expect looking forward and how to avoid any
If we can,
possible
yeah.
situation that's caused that little baby to be laying there right now
Yeah.
in this situation.
No, I'm more than
he's
willing to
in.
do that, and I'm happy to call Dr. Phillips and see when he's going to be here. I'm also going to introduce you to my partner because she's going to be actually around too, because I'm not on call 24/7. Okay.
Well,
So
if
I'm going
we-
to introduce you to her because she'll be in and out of the room. She and I are on the same page. Okay. So she'll be down in a little bit, and I'm just going to bring her in the room, tell you who she is, so you're not seeing a new face for the first time.
Is it too early to ask you is it possible for you to predict when a person of your expertise will no longer need to see Logan? At this point, is it possible for you to predict?
You mean like
Normally
from
between
months down the
10 and
line or
20.
something like that? Is that what
Well,
you're talking about?
immediate and
So
long
that
term.
point's
Okay.
more to what I'm
So,
saying.
But
I
he said
wouldn't.
it was normal
We got so much noise going on.
at the end.
I would not mark him off my list, so to speak, meaning that I don't check on labs and all that stuff every day until everything's back that I've sent off. Okay? So that's the immediate question. For the long-term question, it depends on what I find. If I find that there's an infection there that's going to need long-term treatment or follow-up, then I'm going to
So
need
in
to
other
follow
words,
him.
it's impossible for you to
So it's
answer
impossible
that.
for me to predict. At
Thank
this
you.
point, from what I've seen, I don't anticipate that he's going to have a problem with an infection that is going to be ongoing, that's going to require consistent follow-up with me. Okay.
So we're kinda in limbo at least till Friday, I think.
At least until I get my results back. You know, I can only give you the results that I have. If I don't have them and they're still pending, I can't tell you
give us,
anything.
yeah,
All I can tell you is an opinion of, like yesterday, testing for adenovirus in his brain, but I don't think that it's there because most of the time when it's there, it's somebody with a really suppressed immune system like a bone marrow transplant. I can give you those kinds of opinions, but without the test, you're gonna see it as me saying, well, she doesn't think so, but she doesn't know.
no, I understand,
Okay.
So
That's
the
all I can
results of
give
the
you.
test, is it true that, cause I forget who we've heard it from, that's why I was so excited to meet you. Is it true that 5 days or the response time for the results,
Where's
5
the-
days. Some
on
of
the
them will be
test
back
you
in
ran?
5 days. Some of them take me a week. Some of them take me a little longer. I get them when I get them because they're sent out to these reference labs.
Okay, and if,
Okay.
let's assume that the ones that come out in 5 to 7 days are all negative, at what point would you feel
I tried to
comfortable
keep
in,
the top down.
releasing him from the hospital? Or
Oh,
are you telling me
from
that
that-
he's gonna be here indefinitely?
No. From that perspective, that's a clinical question as to how he's doing. It's a clinical It's a clinical question as to how he's eating, keeping himself hydrated, his, mental status, those kinds of things will determine how long he has to be in the hospital. The tests that I've done at this point, other than the test that's pending for herpes virus, will not require him to be on antibiotics or antimicrobials for a long period of time. And so they would be informational. They would not be something that I would fix.
Okay,
Okay? So from my
Just
perspective,
be careful about this.
Yeah.
his length of stay in the hospital, unless the herpes test comes back positive, only has to do with how he clinically is looking and whether or not he's stable clinically to go home.
okay.
Okay?
Now I have one other question, I will leave you alone.
Okay.
His immune system, they're talking now about beginning rehab for the loss of brain damage. That's gonna require a lot of him being awake and, with the stimulation and everything. Is it better for him to be on a schedule sleeping? Is it better for his body to recover by sleeping, or should,
We start the therapy now. Is it gonna hurt him to try to stimulate him because he's not strong enough to? Or is he ready to start therapy whenever, even though he's fighting off the infection?
So
the question
what
is,
I would say is from an immune system perspective, it doesn't matter. Okay? From an immune system perspective, if he's getting adequate rest to fuel his body, if he's getting adequate nutrition to fuel his body, then his immune system will get enough fuel for that.
so he won't need a specific amount of sleep daily?
He's gonna sleep when
For
he
his
needs
immune
to.
system, no.
That's what I
His
said.
body
He's
knows.
gonna fall asleep
Well,
when he's tired.
He
But
he may not be able to participate if his body's tired and needs to
Right.
recover. He may not be able to participate fully in therapy.
So if he
But-
wants to sleep, let him sleep,
Squeeze him right in
Absolutely.
right
and then
now.
we'll leave it up to the PT or
Mhm.
MT or whatever, whoever's working to make the call on whether he
It's like
should
he knows
sleep
where
or
I'm at,
whether
he
they
knows.
should keep him awake but it's not
Assuming
gonna.
Dr. Phillips is okay with that, that's what I would say from the infection side of things, from the
That was my question,
from the immunology side
because
of things.
obviously we wanna begin recovery as soon as possible, and got excited today when we heard about, the therapist coming in to begin the
Sure.
brain recovery. But I didn't wanna, it's catch-22 is how I was looking at it. Well, what if this lady says, he needs to rest because his immune system, can't work properly without being fully
Logan's
rested.
gonna
So
tell ya.
my question is answered with that.
Yeah.
You're wonderful, and I appreciate your time.
No
I'm gonna go
problem.
back down and eat.
No problem.
When we're all finished, can we try to let him get some rest? Get everybody out of here.
He's resting.
Yeah, but I think he's sitting there listening. Love you, Nike. I'll be down in the cafeteria if anybody's hungry.
No problem. No problem.
I wanted to ask you
Sounds
about,
awesome. Like,
when he did go and get his shots, they did just a simple blood test.
Okay.
And I don't know what they test for, but I know that his hemoglobin is very high. Would that look any different if his immune system was suppressed at that time?
Would the hemoglobin look different
Yeah,
if
'cause he
he
was a
had